Hi, and welcome to our podcast, Among Therapists, Practical Tips by Psychotherapy Academy. I'm Dr. Jessica Díaz, and I am an editor at Psychotherapy Academy. This podcast provides practical and effective tools for use in your clinical work. You're listening to the 14th episode of our series, Learning Prolonged Exposure for PTSD, a comprehensive guide for clinicians. This series is an extract from our on-demand online training covering the fundamentals of prolonged exposure, or PE, for post-traumatic stress disorder, PTSD. In the previous episode, we examined a step-by-step guide to implement Imaginal exposure with clients with trauma. That guidance included details such as the steps for explaining the procedure to the client, tips for narrating the trauma memory, and the importance of giving encouragement during application of the Imaginal exposure. When done successfully, this is a powerful technique for overcoming trauma and processing the emotions related to it. In this episode, our faculty member will share an example of how to implement Imaginal exposure with a real client. Stay with us if you want to know how an experienced therapist applies to this technique. Our faculty member is Dr. Barbara Rothbaum. She specializes in research into the treatment of anxiety disorders. She's been studying PTSD treatments since 1986 and has authored over 350 scientific papers and book chapters on this topic. This audio is an extract from our online course, which allows you to earn 7 CE credits after answering multiple choice questions to test your knowledge. These credits are valid for psychologists, counselors, social workers, physicians, marriage and family therapists, and addiction professionals. In future episodes, we'll give you more details about PE. But for now, let's listen to and learn from Dr. Barbara Rothbaum.
In video 7, I want to give you an example of an Imaginal exposure transcript. This is the case of an adult female sexual assault survivor that I treated a number of years ago. When she presented for treatment, she was 31 years old, married, Caucasian. She had a master's degree. She presented for treatment about 1 year after a rape in her townhouse. Her complaints were of nightmares, fears of being alone, avoidance of sex with her husband, hypervigilance, jumpiness, checking locks, decreased concentration, which was causing difficulties in school, and she was avoiding taking her dogs for walks after dark, being downstairs alone, or discussing the assault with everyone. So this is a transcript of her Imaginal exposure narrative. I should warn you, it does have some upsetting material in it. I see this person in the doorway of the stairwell, and he seems to be rushing at me, and my heart's pounding. I'm really surprised, and I know I'm really in trouble. He has this thing at my head, and he says if I scream, which I don't because I've got fingers practically down my throat, that he'll shoot me. He says, "Where did your husband go?" And I say, "Just out to do something very quickly. He'll be right back." And he says, "I've got my buddy waiting for him." And that really scares me because it seems like now this is some type of horror story or something that we're both going to be hurt. He says, "Get on the bed," which again scares me. I didn't expect that. It's the first time I suspect rape. So I get on the bed. I don't see any choice, any way to escape. I think there's somebody downstairs. He whacks me across the face and he says, "Don't scream anymore. I think this man is really dangerous. He can really hurt me and I have to be careful." So I have to figure out how much anything I try to do is going to provoke him and not let it get that far. He's pushing too low and I feel burning, sharp, cutting, and then it goes in. And I don't really feel it after that, just like movement. He says, "When I'm done with you, my buddy's coming up." That's just another terrifying moment. I want to get out. I can't have that. Another person going to hit me. I'm saying, "No, no, please don't hurt me. No, no." And I hate it. I hate whining. I hate myself hearing myself say it. I wish I would stop. It's like I can't make myself stop. He comes off of me and says, "Kiss it." which I don't want to do. My mouth's bleeding and it hurts. It just looks evil and I think it's dirty and I don't want to do it. But he pushes me down and I'm afraid I'm going to be hurt. So I just do it. I'm shaking now. It's cold and I'm embarrassed. It's very peculiar. It's like I'm again suspended and I'm nude in my bedroom with someone I don't know. It's like the same feeling when you dream you're at work, but you're not dressed correctly, like you wore your pajamas to work or something. Sort of a little panic and embarrassed, and you don't want anyone to see you. Those were excerpts from her Imaginal exposure, and you can hear that it's got a lot of the information we want included. We want information about the stimuli, and she includes that. You want information about responses, and she includes that. I think she says, my heart's pounding at one point. And you want information about the meaning, and she has a lot of information about the meaning. Now I think it's really dangerous. There's someone downstairs. They're going to attack my husband too. We're both going to be hurt. And again, in therapy, we're going to repeat this over and over again every session. These were just excerpts from her narrative, and we're going to repeat it session after session. Some key points from this video. In this example of an imaginal exposure narrative, the patient included information about the stimuli. It looked dirty. It looked evil. Her responses, I could hear myself screaming. And the meaning, now I think this is really dangerous. She speaks in the present tense to help engagement. She describes many points that'll be important to discuss in the processing.
Okay, so that was Dr. Barbara Rothbaum sharing an example of how to implement imaginal exposure with a real client. The client was a 31-year-old married Caucasian female who had experienced a rape in her townhouse about a year earlier. Her complaints included nightmares, fear of being alone, avoiding sex, hypervigilance, jumpiness, checking locks, and difficulty concentrating, which are common symptoms in PTSD clients. For the imaginal exposure, the client described her experience during the rape, including feelings of surprise, fear, and feeling like she had no autonomy. The therapist allowed the client to talk about the experience while she guided the technique. Some of the prompts were to find the initial moment of the trauma memory and revisit it in present tense. The therapist was aware of the client's emotions, taking care not to overwhelm the client, but also staying with the trauma memory as long as necessary to process the trauma and its emotions. The purpose of the imaginal exposure was to repeat it in therapy, discussing the responses, emotions, and meanings conveyed by the client's narrative. This technique is used to help the client gain insight into her trauma and cope with its impact. Okay, so this has been the 14th episode in our series, Learning Prolonged Exposure for PTSD, a comprehensive guide for clinicians. Stay tuned for forthcoming episodes in which we'll introduce more details about PE. If you want to know more now, you can enroll in our course, through which you can earn up to 7 CE credits upon completion. If you're a psychologist, counselor, social worker, physician, MFT, or addiction professional, these credits will be accepted by your professional board. To learn more about accreditation and the course, you can click on the link in the show notes. This is an on-demand course, and all modules are available in multiple formats. You can watch videos, listen to audio, and download PDF transcripts of all course modules. You can also access exclusive content that isn't included in this podcast. If you've enjoyed this podcast, kindly help us to spread the word by leaving a review on Apple Podcasts and sharing it through social media or word of mouth. We really appreciate your support. Thank you so much for listening. This is Dr. Jessica Díaz, looking forward to seeing you again for the next episode. Bye-bye.